At this time, today's program, over to Canada Health Infoway. The floor is yours.
Welcome to everyone. This is Dennis Giokas, CTO with Canada Health Infoway, and I want to welcome you to our second webinar, this one being on cloud computing and health, where we're going to do a specific deep dive into privacy and security considerations. Our first webinar a few weeks ago covered cloud in general terms, and I would encourage you to take a look at that presentation and listen to the webinar if you want more information on that particular topic. We are recording this session as well for future posting on our website, and as the moderator said, we will take questions at the end through the question answer feature of the web software. I will moderate those when we get to the end of the presentation, and I will not identify anyone by name, so please feel free to ask questions when we get to that point in the session. This webinar does represent Infoway's point of view, and it's intended for information. We may, in the course of the material presented, mention specific vendors or specific technologies. It's not meant to endorse or promote any of those or any specific vendor, nor do we have a financial interest in any of the vendors that we might mention in that context. This group and function within Infoway is fairly new. I just want to give you a very quick update on who we are and what we do. You'll see on the slide that's being presented now our mission and vision statement. So our mission is to identify, assess, and promote emerging and disruptive information and communication technologies. And in context of that, as the last sentence of the mission identifies, to promote these analyses and investigations through any number of means, typically our white papers and through this webinar series. A vision for us is to appropriately and effectively use and promote the health of Canadians and the sustainability of the healthcare system through use of these emerging technologies. So key questions we attempt to answer: what innovations in health and health IT, what exists today that we should be using in that context, what are emerging that we should consider at some point, and we always take a business perspective and economic perspective on what we do, so which ones do have value to apply in a Canadian healthcare context. On the next highlight, what differentiates our white papers from some of the others you might see on topics such as these. First and foremost, we always take a business perspective, a look at topics that are relevant to Infoway and our stakeholders and align with either their priorities or going forward priorities for Canada and for Infoway. We'll take a very objective perspective. We will take a perspective that's very broad, cover a wide range of topics related to that technology versus going very deep into any one area, and try and address the needs of a range of stakeholders, whether you're the CEO or CIO or CMIO or a business analyst or an architect or a subject matter expert on a specific technology. We're trying to address the various stakeholders in each of these papers. We'll always present a topic with a health context, such as what we're doing today around cloud, down into specifically a digital health context, how it might be used in the context of delivering these digital health solutions, and even where appropriate, drill down even further to make it relevant to current initiatives or future initiatives that our various stakeholders might have. And then we look at it from a technical perspective. We'll cover all four of these areas today in this webinar, specifically privacy and security, how these various technologies can be deployed, how it can be applied to specific digital health functions, in other words, specific kinds of functionality, and how it might relate to things you have done in the past, such as standing up your EHRs, or how it might relate to things you are doing on a go-forward basis in the context of new functionalities. So over to Stanley Ratajczak. Stan is a member of the Emerging Technology Group and our subject matter expert on privacy and security, and he was one of a four-person team that worked on this particular white paper. And his responsibility, obviously, was in the privacy and security considerations area. So, Stanley, I'll turn it over to you.
Thank you, Dennis. Welcome, everyone, to privacy and security considerations in the context of cloud computing and healthcare. Today, what we'd like to do is start off with a brief summary of what is cloud computing, but we'll look at that in the context of privacy and security aspects. We'll talk about the privacy and security considerations related to cloud deployment models. We'll also look at cloud as a privacy and security enabler, which is a interesting trend and a welcome trend that we're seeing. And we'll close with a couple of key messages regarding cloud privacy and security. So Cloud Computing in Health is the first in an emerging technology white paper series. It's designed to address, as Dennis had mentioned, cloud computing, but from a Canadian healthcare perspective. The intent is to provide insight and some scope on the potential applicability and utility of cloud computing, provide some context for business opportunities and challenges, suggest possible approaches for the use of cloud computing, and there's also in Section 8 a bit of a medium-level dive on the safety and security aspects of cloud computing. The intent for this is to be a call for action for further focused conversations on cloud computing. So the next couple of slides will talk about the three major components of cloud computing, but I won't get into these in a fair amount of detail. I would suggest that you look at our first cloud webinar that goes into detail on each one of these major components of cloud. It's really a Cloud 101. So we're looking at cloud infrastructure, the three service models, and the deployment models. So the first major component of cloud computing is really the infrastructure. So this is the networks, the CPUs, the storage, and it's virtualization, which means that you have an on-demand and self-service capability. So capacity is only there when you need it, and those services are readily available and they're transparent to you. This obviously requires network access, and that network access needs to be reliable, stable, so that you can access your cloud infrastructure through a broad range of devices, whether it's mobile or desktop. The fact that cloud computing is shared among many users means that your resources are most likely pooled, and we'll be getting into more detail on that in a moment. The fact that you have on-demand and self-service capabilities, at least from an infrastructure perspective, means that you need to have rapid elasticity. So capacity can increase and shrink instantaneously as you need it, which is a very important factor. Because of all of this, you need to measure your service. So the service provision from a cloud perspective is carefully managed because you're paying as you use cloud services. The second major component of cloud computing are service models. So cloud clients can access any one of these service models through their web browser or their mobile applications, and it's known as cloud software as a service. So it's software that is provided over the internet. So think of Netflix, iCloud, Microsoft Office. This type of software is available to you with little configuration, and it's not installed. I mean, there is no local installation required, which is of tremendous benefit. And available to every user that has a connection, so available to all. So good examples of software as a service could be secure email. If you're doing a remote backup and storage in iCloud, you can encrypt that, so you can have encrypted storage. And there's also the mobile device management services that are being offered in the cloud. This layer is cloud platform as a service. So these are your databases, your web server development tools, things of that nature. And some examples of that could be the platforms necessary to develop your security and trust functionality within web services. Another interesting trend that we're seeing is a platform available in the cloud to start developing your mobile applications. So mobile applications can now be developed in the cloud on these platforms. And lastly, we have cloud infrastructure as a service. So this is really the virtual machines, the CPUs, things of those nature that can be offered to you on the cloud. Examples of that could be load balancing of firewalls or an enterprise intrusion detection environment. The major component of cloud computing are the four deployment models. So we'll focus a lot of our time today on that aspect. So first is a private cloud. These are clouds that are typically customized for one organization where you have control over that cloud. The next deployment model is community clouds. So these are clouds that are designed and implemented for a given community that have shared purposes. And this typically results in shared governance and management of those clouds. Clouds, as the name suggests, are totally open to the public. They're managed by the vendor. There is no expectation on behalf of the cloud users with regards to governance or management of those clouds. And then lastly, there's hybrid clouds that are essentially a combination of the first three models. Before we get into what differentiates the privacy security considerations between the various cloud deployment models, let's take a moment to look at what services, privacy and security services, are common across all models, all cloud deployment models. And these are the basic things that you'd see in any IT environment, whether it's auditing and monitoring or identity management. These things need to be in place, notwithstanding the cloud deployment model. Differentiates the community cloud, private cloud, or hybrid cloud environments. It's really about the degree of organizational transparency and accountability and the control you have over that. Also, the governance of cloud usage and its infrastructure varies by deployment model. And the level of privacy and security of personal health information manipulated in the cloud may vary based on the model. In the context of hybrid cloud environments, the complexity of managing multiple cloud service providers is also one consideration that should be examined closely. In a hybrid cloud environment, you may have multiple vendors, each playing a different role, and so those considerations need to be evaluated. Look at the various cloud models, this time from a privacy and security perspective. So in a private cloud, we may have applications that are offered by the cloud to clinicians. This cloud is typically implemented for a specific organization. The cloud may not be owned or run by that organization. The cloud may be outsourced, but it is implemented specifically from one organization. Therefore, the users are restricted to that community. The community or the private owner of that cloud has exclusive control over governance, audit, accountability, and transparency. And therefore, this offers the greatest potential to manage IT security privacy risks. And so the fact we would hope that this private cloud would meet the organizational privacy and security requirements. The considerations associated with a private cloud are really about the operational costs with regards to privacy and security portfolios. As this is a private cloud, that organization would have to incur those costs, and those costs also include the specialized resources necessary to manage privacy and security. Community clouds. In this example, we have a health region that's operating a community cloud, and these applications are available to multiple stakeholders, in this case clinics or hospitals, but nonetheless this cloud is dedicated to a specific community. So you would not, most likely not see, a manufacturing industry part of a healthcare community cloud. So users are restricted. There is normally a shared governance and accountability structure associated with community clouds, and therefore allowing you greater transparency and the ability to manage privacy and security related risks. In the community cloud, another characteristic is that you would have common privacy and security requirements and safeguards. So this actually helps to ensure that risks are managed appropriately. Considerations, well, in a community cloud, if you have shared governance, then you need to address that aspect of being able to share governance across these multiple entities, the hospitals, the clinics, or those that are part of that community. You need to give consideration to what role, if any, data custodians would play in the governance of a community cloud. And so you would obviously need to establish those common requirements and data safeguards within each community. As the name suggests, the cloud is open to the general public. So in the case of Gmail, you would have citizens as well as providers each using those public cloud services of email, and you would therefore have a multi-tenancy environment. So individuals could be citizens, could be manufacturing, multiple entities would be using this public service. Also, there's no expectation of management or governance over where data and IT resources are located. So if that is a concern to you, then you need to give special consideration to how data is allocated. And typically, in a public cloud environment, data safeguards and governance are opaque. Security considerations associated with a public cloud environment is the due diligence on the implementation model. So organizations really need to do their due diligence as to whether they want to use a public cloud or other clouds, and that due diligence would be based on data classification, personal health information confidentiality and the location thereof, and ultimately be able to assess the appropriateness of safeguards. So a hybrid cloud context, let me set this up for a moment. We've got regional health authorities that may set up a private cloud that operates a hospital information system. And we may have a community cloud that offers a client registry or provider registry application to clinics as well as hospitals. And you may have a public cloud that operates an unsecured email application that allows communication between patients and clinicians. All these three clouds may be interconnected. And so in terms of characteristics, we would have a segregation of workload and functionality. We may have multiple levels of safeguards and governance associated with each one of these clouds. And in terms of considerations, we really have to give some thought as to how we do due diligence between these clouds to ensure that we're satisfied with the data safeguards. There's the complexity associated with the governance of these different cloud types, which means that we most likely would have to develop trust models between these cloud implementations. The consideration should be where we place mission-critical business solutions within these hybrid cloud environments. Before we get into the specific IT security considerations associated with the cloud deployment models, let's talk a little bit about the ones that are generic to each or to all the cloud deployment models. First one being governance. So we consideration to the data custodial responsibilities and the delegation of some of those functions to the cloud environment, which means that in certain cloud environments there's the potential for externalization of oversight, accountability, and compliance. So these things need to be thought through, notwithstanding the cloud deployment model we're using. There's also the aspect of personal health information aggregation and consolidation. In a cloud environment, typically data storage is shared with other users, other organizations in a community cloud, and in a public cloud environment, particularly multi-tenancy, as well as the IT resources. So if data is shared or stored on the same drive as our industries, you need to think about those issues. Another aspect of cloud computing is the support for multi-tenancy business solutions. So in an example where we have an EMR that's running in a community cloud for 150 clinics, does the application, the EMR application, support multi-tenancy, i.e. multiple clinics? Ensure that Clinic A does not see the personal health information of the patients from Clinic B. So solutions need to be designed to support multi-tenancy when they're operating in the cloud. So that's an important consideration to think of. The next is the alignment of privacy and security requirements. So we strongly advocate that organizations define their privacy and security requirements as well as their safeguards before choosing a cloud deployment model. This will then allow you to assess the levels of assurance, IT security mechanisms in cloud before choosing a model or a cloud vendor. That's global to all is the confidentiality and integrity of personal health information. To have end-to-end confidentiality and integrity. We would suggest that you probably would, especially in the context of multi-tenant environments. And the aspect of auditing, monitoring, and compliance is also applicable to all the deployment models. So there are several jurisdictions that require data custodians to be able to audit and monitor access to personal health information. So a patient may walk up to a healthcare facility and ask, who are the individuals that access my personal health information? If that capability is offered through the cloud, does the cloud service provider, does the cloud deployment model offer you the ability to do that auditing and monitoring of transactions? Does the cloud service provider offer the possibility of an independent third-party audit and compliance? There are things that need to be considered with each model. The risk management frameworks that are deployed by cloud service providers are also important, especially determining whether or not they are appropriate for your use. So there are various tools that are typically part of a risk management framework, and what's really important is that there is transparency in the risk management framework. Organizations need to ensure that they have access to the results of threat risk assessments, privacy risk assessments, as well as the remediation plans for correcting any vulnerabilities. It's important as well to consider when doing a due diligence of a cloud service provider to leverage third parties to assess privacy and security safeguards, policies, and procedures. And to that end, the cloud industry has made great strides in trying to address privacy and security issues and considerations. They're providing tools that can be used for due diligence, such as the one cited here, the Cloud Controls Matrix from the Cloud Security Alliance, as well as documents from NIST. And we strongly encourage you to leverage these tools when considering any cloud deployments or cloud vendors. And that's common to all cloud deployment levels are service level agreements. And with that regard, you need to be able to anticipate exceptional circumstances that affect your obligations. So do you have the functionality that you need from a cloud service provider to do investigations for privacy or security breaches? Essentially, it boils down to SLAs that permit healthcare organizations to meet their legislative obligations and data custodial responsibilities, as well as having the incident and contingency strategies part of your SLAs. So cloud as an enabler. We're starting to see an interesting trend where IT and privacy, security and privacy services are being offered in the cloud through software as a service. What we're seeing is that these implementations would typically be for greenfield deployments. A perfect example of that would be the Ottawa Hospital that is using mobile device management capabilities from the cloud. So rather, as they deploy their mobile devices, rather than purchasing the software and the hardware necessary to run the software in their own IT environments, incurring those costs, they're actually using that capability from the cloud. An example would be the Government of Canada in its community cloud that is offering secure email to all the users of the government cloud. Now, public clouds can play a very important role especially if you're using anonymous or de-identified data. So public clouds can be used for big data analytics, predictive analytics, and potential diagnosis options. A good example of that would be the use of Watson to do any type of big data analytics. If Watson was offered in a public cloud, it would not be an issue if anonymous or de-identified data was used in that context. Let's talk a little bit of a few key messages. Community or private clouds offer the greatest potential to reduce your generic cloud risks, and that's simply because of the governance model where we assume that in a community or private cloud, you would have total control over IT security mechanisms and governance in general. Any of the cloud deployment models could probably be leveraged as appropriate to the needs of your applications in your community. So you actually consider all four of those deployment models as potential models to use. The of a cloud service or a deployment model really depends on the ability of data custodians and information managers to their obligations. So you need to know what your obligations are and be able to determine whether or not that model, deployment model, and/or vendor allows you to meet those. That's really the core message here. And the good news story is that the cloud industry is addressing privacy and security concerns through the various tools that we've mentioned earlier. We, again, encourage you to consult those. So Infoway, as part of its research, has also contextualized cloud computing in Canadian healthcare context. And as part of that, we've identified certain points of view, key assertions that are in the paper. First and foremost is that privacy and security risks and requirements are similar across all computing models. So whether you're running your own IT shop, you're outsourcing IT, or considering a cloud computing model, all of your privacy, security risks and requirements are fairly similar. So cloud is no different. Security issues are manageable. However, the solutions must be by design and must take into account the importance of data that you're putting in the cloud, as well as the cloud operational context, the cloud deployment model. Differentiates the various cloud deployment models boils really to the level of transparency, the level of oversight, governance, and the ability to manage privacy and security controls. So that's, in a nutshell, what differentiates the four deployment models. I believe that the use of public clouds for storing and accessing personal health information requires serious consideration of the risks associated with that capability, but there are solutions. An example would be end-to-end encryption, where data is encrypted from the mobile device to the hard drive where that data is stored, wherever that may be. It would entail that data would be decrypted only when needed and accessed by an authorized user, which means you would have control over the encryption keys. And public clouds can provide value when de-identified data is used. I believe that there are many opportunities for cloud-based privacy and IT security solutions. These would most likely take place in greenfield deployments and must be interoperable with existing infrastructures. So as your cloud-based privacy and security solutions interconnect with your existing networks, we suggest that those capabilities, privacy and security capabilities, have to be interoperable with what you currently have. We will open to take questions.
So we will open it up to questions. If you do have any questions, please type them into the Q&A box as part of your webinar link, and we'll repeat the audience and address those as they come in. When in time don't have any questions, why don't we just cover some logistics for on a go-forward basis. Stanley, if you could just scroll ahead to the next slide. You will be getting in a few days a evaluation form. We'd love for you to fill that out, and after you've done that, you will also get a link to the PDF of this presentation and a link to the recording of this webinar. So we really appreciate your feedback. It's very helpful to us, and we will try and address some of those points on a go-forward basis. Come in. Can you elaborate on what you mean by level of transparency?
Excellent question. So in terms of transparency, in a public cloud environment, there's no expectation that the public cloud provider would share the details of their security solution, even details of their risk management framework. So when operating a community cloud or part of a community cloud, you would expect to see the summaries of the privacy impact assessments, the threat risk assessments, so that you would be able to make a judgment call as to whether or not, as a data custodian, your information is adequately protected. So you would need to see either summaries of those reports and definitely summaries of any remediation plans that your cloud service provider has identified, and that would be part of an overall governance structure, a governance structure.
Thank you, Stan. Another question, are there any good examples of hosting of actual healthcare applications with personal health information in the cloud?
Not that I'm aware of, at least not in Canada. No.
EMR vendors that I know in the U.S. that are doing that. Another, subtlety to that question is you could think of software like EMRs or hospital systems being deployed as application service provider models. They could be cloud-based with respect to the hardware deployment in those ASP models, and therefore the PHI would be cloud, so to speak. Another, I think, good example, Stanley, would be TELUS Health Space, whereby your personal health information in that personal health record is, if you will, in that private cloud that TELUS has stood up for purposes of offering that PHR functionality. So just a few examples to bring it to life for our attendees.
Yeah.
Can you discuss the differentiation of Canadian-based cloud services versus foreign USA-based cloud services with respect to data privacy? So a very relevant question.
Sure. If a cloud provider stores data and or operates IT services, the applications in the U.S., those applications of that data may be subject to requests for access with regards to the Patriot Act. So it really boils down to clearly understanding what the risks are, if any, with regards to offshore data storage. Whether or not your cloud provider actually does do any offshore data storage. Many of the cloud services, Dennis, that you made reference to here in Canada go out of their way to make sure that the data is stored locally here in Canada and all the IT servers are here on Canadian soil. So really need to think about whether or not that is something that your cloud provider is doing.
About using third-party authentication, and this example is such as using your Facebook identity to log into this application that might be in the cloud.
Excellent question. It really depends on the level of assurance that you deem is appropriate with regards to accessing personal health information. So if you're accessing an application in the cloud, does your Facebook identity and credentials and the authentication mechanisms associated with that are sufficient to meet your requirements that you've most likely identified up front? Some have actually argued that credentials such as the ones that you have in LinkedIn are probably more robust than credentials provided by Facebook or other social media, simply because there are many individuals in a professional capacity that have vouched for your identity on LinkedIn, and those may have more credibility than in other social networks. But it really boils down to, do you feel comfortable with the level of robustness of not just the identity management, but the authentication techniques that are supported by social media?
Can you summarize the difference between true cloud-based service versus, I think what this person is referring to, that ASP model that I referenced earlier, where it's hosted or off-site?
Mm-hmm. So in a cloud-based context, if you were running an EMR on behalf of hundreds of clinics in a cloud environment, and that application has been designed to support multi-tenancy, then you would be able to allow the individual clinics to manage the role-based access control associated with that application, the EMR application. Many vendors, what they've done is they've simply taken that application, the EMR application that is designed for one clinic, and running it either an ASP or an ASP in the cloud, and they're quote-unquote cloudifying that application. There are solutions to that. I mean, you could actually run that application that's designed for one clinic in a virtual machine, and therefore you would have, if you have 100 clinics, you would have 100 instances of that. So that's still a viable solution to codify an application that was designed for one clinic. It's just that as a cloud consumer, you have to have a very good idea of what you're purchasing and what context that's being run, and whether or not that meets your requirements. Both are possible, both can work. but it becomes an issue of how friendly user management becomes in that context.
Yeah, and I think the key thing here is cloud is a bit of a physical deployment model of some of these applications where, as you pointed out earlier, the network, the CPU, and the storage are virtualized, and you get that kind of on-demand elasticity, resource pooling, and depending on which kind of cloud deployment model you stand up, you may be paying on a usage basis versus buying the hardware and capitalizing the hardware investment up front, whereby the usage-based approach becomes an operational expense for the IT organization.
Correct. Yeah.
This is an Stanley. Do any or some of the Canadian cloud providers provide guaranteed Canadian transit? I assume this means the network path of the interface between the caller and the callee in this cloud environment. Or are they also subject to transit points that might go outside of the U.S., outside of Canada into other countries such as the U.S.?
Excellent question. I agree. I don't know of any examples that are that guarantee, but that would most likely be one of the questions I'd put in place, or I'd ask a vendor in the context of due diligence, a due diligence process. Now, whether that traffic goes to a non-Canadian node or not, that may or may not be the issue, because you need to understand the bigger picture, which is would hope that that data traffic would be encrypted. It's going your desktop, your mobile device, and through the network into your cloud service provider and that cloud application. So if it's encrypted, you may have less of a concern of data confidentiality if it's going through a node that is non-Canadian based. So I think we need to take a holistic approach as to how that actually occurs.
Earlier around encryption, it applies to data in motion, as you just described, as well as data at rest.
Correct.
Here, with regard to user credentials, are there any standards that drive the specific requirements of a login and password?
And unfortunately not. Those are part of the determining of your organization's requirements for authentication and identity management. But there are several industry standards that support interoperability, but there is not one standard that is common across cloud service providers or cloud vendors. Really what we're starting to see is that the cloud vendors are trying to support the most common authentication standards and issuance of credentials, whether it be SAML version 2 based or other. Those are the types of things that they're supporting because of the facility to interoperate with your existing systems, but there isn't an industry standard per se.
Okay, questions at this point. We'll stay on the line for a few minutes while we cover a couple of other slides. Stan, if you could move forward one. I just want to call your attention to our next webinar, which will be on the topic of emerging health information standards, and we're going to cover two of those during the webinar. One's called Health Information Resources, otherwise known by the acronym FIRE, and that is an HL7 initiative that we are influencing and tracking, and we'll report on that and where it's at. The other one is the Clinical Information Modeling Initiative, otherwise known as CIMI, and that multinational initiative that right now exists outside of any formal SDO, and is got a number of countries that are participating in looking at developing clinical information models that can be used for anything from interoperability between systems to screen design to data storage. So we'll give you a bit of insight as to where that's at and where that is going. So the webinar will be on Wednesday, April 3rd at 1 o'clock, and we should probably update this slide to show it will be Eastern Daylight Time, given that we moved the clocks ahead on Sunday this weekend. You'll have a webinar link there on that slide, so please join us for that, and you can sign up either through the email that you'll get or through the Infoway website. under the Events tab. Just get to the next slide, Stan. A number of links here that will be available to you when you download this presentation. Obviously, the URL to our website. We have an Emerging Technology Group landing page that you can get access to a number of publications from there. If you want to reach any of us as a group, there is an alias through which you can pose questions or suggestions on future topics, the Infoway blog, and the Twitter ID. Okay, I'm not seeing any new questions come in, so I want to thank you very much for joining us. Thank you to Stanley Ratajczak for presenting today on this particular topic, and we will look forward to having you join us at a future session. So thank you very much and have a great day.